We are currently at the fifth wave of COVID pandemic happening in Taiwan.
And I think with closer human-animal interactions and with climate change, we will see some more spillover of these viruses.
Actually, we are at the hotspot. The Southeast Asia and also Asia Pacific area are usually among the prioritized area of that kind of newer emerging disease could emerge from this area.
Hello and welcome to Connected. I'm Divya Gopalan. Remember the days when people were taking daily COVID tests and you wouldn't leave home without a mask? While it may feel like the global pandemic is a thing of the past, scientists say we really shouldn't be letting our guard down. Now, according to the World Health Organization, nearly 10,000 COVID-19 related deaths were reported in December alone last year, while hospital admissions during that month jumped 42% in nearly 50 countries, mostly in Europe and the Americas. And as world leaders and decision makers meet at the World Economic Forum in Davos, Switzerland, there's much discussion over preparing for DiseaseX. And to understand where we are in the pandemic and what the future holds, we are joined by Dr. Lo Yi-chun, the Deputy Director General of Taiwan Centers for Disease Control in Taipei. And from Washington, D.C., we're joined by Anirban Mahapatra, a microbiologist and the author of the best-selling book, COVID-19, Separating Fact from Fiction. Thank you both so much for joining us. Dr. Lo, let me start with you here. How would you define the pandemic's current status in Taiwan?
We are currently at the fifth wave of COVID pandemic happening in Taiwan, but it's much milder and less pressuring than the previous waves because I think more people are getting vaccinated and also our healthcare facilities are prepared for encountering such more like between pandemic and epidemic outbreaks. Now we are seeing increase of outpatient and inpatient visits of COVID, but the estimated peak will probably happen 1 week before our Lunar New Year festival. But the daily peak will probably reach only like 15,000 per day. So it's much milder than previous waves.
Anirban, the world seems to be back to business as usual, but the WHO data we just read out says otherwise. Can you explain?
Yeah, I think a lot of it has to do with pandemic fatigue. We are entering the fifth year since the start of the COVID-19 pandemic. And I think we have to approach COVID-19 with definite humility. We don't know, nobody would have predicted that this pandemic would have gone on for so long. And this recent variant, the JN1 variant, which has popped up and risen since September, which is a subvariant of the BA.2.86 of Omicron, is now in the United States, where I'm based, creating one of the greatest waves in the past few years. We can gather from the wastewater and from the hospitalizations that there is a major peak going on right now. But it's shocking that in the United States, less than 20% of adults who are eligible for the vaccine have been vaccinated. And I think less than 10% of children have received this vaccine, despite this vaccine being available. So I think it is a bit of complacency and also a lot of just COVID fatigue.
I want to talk a little bit more, dig deep more into this variant. But before we do that, let's put it into context here and take a look at how this pandemic affected the world population and its current status. Now, since its outbreak and until January 16, 2024, more than 700 million people have been infected by COVID-19 and nearly 7 million people have died. More than 672 million have recovered, but there are still more than 22 million active cases. Now, Dr. Lo, as Anirban was saying, JN1 is the latest variant. Can you tell us how different this is from past variants and whether it is affecting Taiwan?
Yeah, JN1 definitely holds more mutations than previous mutants, but fortunately, I think recent studies show that these newer mutants do not lead to increased severity, but just lead to more transmissible characteristics of the strain. So we are also seeing the variant increasing in Taiwan. Recently, I think the data is showing increasing from 10% to about 31% recently. And we are forecasting that this JN1 will become the dominant circulating strain after our New Year festival, because a lot of these personal gathering will happen during the festival. But this driving force will probably be countered by our recent catch up of the XBB vaccination in Taiwan. Now our vaccination rate among our elderly population rapidly increased to around 12%, and we are hoping to reach higher before the New Year festival. And I just want to echo the idea or concept of COVID fatigue. We're also seeing a very interesting contrast that although COVID is viewed by a lot of people as a much milder disease, but it's still very more severe than our seasonal influenza. The death number is probably 5 or 10-fold of the influenza data. But the uptake of influenza vaccine is much higher in Taiwan than XBB vaccine. So we are doing hard to advocate XBB vaccine for its importance and also its safety. And I think a lot of these social media and also traditional media are helping us to get the words out, to encourage people, not only just the elderly people, but also adolescents and the adults. The readily available XBB vaccine is also effective against severe disease and death among these other populations as well.
Right, Anirban, you briefly touched on the impact of JN1 in the US, but can you see it spreading around the world like we've seen other variants?
Absolutely. I think as Dr. Lo mentioned, it has taken a very short amount of time from the reporting of this variant to now it becoming the dominant variant in the United States and in many parts of Europe. I think wherever the surveillance is suitable, this is showing up as a major variant. But I was recently in India, and the surveillance mechanism there is not nearly what it was during the height of the pandemic. There's very little masking going on, so I assume there's a lot of spread, but we don't really know the extent of that in many other parts of the world. Where there is surveillance, this has come up or is coming up to being the most prevalent variant. But I will also echo, based on what my knowledge is of the United States, the point that Dr. Lo made, that even in the United States, it is shocking that more people have opted for the seasonal flu vaccine than have taken the highly effective COVID-19 vaccine, which would be protective in this case.
Going back to the idea of COVID fatigue, Dr. Lo, I think people are just really reluctant to go back to those stringent measures that were taken, to the daily reporting of numbers. People want to get on to business or back to life as usual before the pandemic. So what measures should we be taking that won't necessarily put us back into those years which was very difficult for many people?
I think a good foundation of Taiwan is, although we liberated most of the restrictions after May last year, but we still keep the mask mandate in the healthcare facilities and long-term care facilities. So those are already there in place. So visitors or patients going into the facility and also their healthcare workers should always wear a mask when applied. We don't plan to increase any mask mandate in this season because we know the public uptake will just be low and there could be a force against us among more stringent measures. But we do encourage voluntary wearing of the mask among elderly and those with chronic disease and also among crowded places such as public transportation. Those kind of recommendations are already the same since August last year, and we don't want to change it. We want to keep the mask wearing as a voluntary habit among our public. And if they don't choose to wear a mask, there's no punishment. But I think in East Asia, we see that wearing masks is more like a habitual or voluntary way to showing your concern or your care about your friends or your relatives. You are aware of their health and also protect yourself as well. So vaccination and mask wearing and hand hygiene, those are the three crucial ways to protect yourself during this winter influenza and COVID season.
Now, Dr. Lo, this is going to be a familiar story for you. I'm going to take you to this video we prepared. Taiwan was among the first nations to sound the alarm at the onset of the COVID-19 outbreak, and its rapid and efficient response to curb the spread of the virus made it an example to the rest of the world. However, the journey was far from smooth. Here's a look at how Taiwan fought its battle against COVID-19 and the lessons learned from the pandemic.
This is the Central Epidemic Command Center at Taiwan CDC under the Department of Health and Welfare. It was the heart of the country's fight against COVID-19. For almost 40 months, every day at 2 p.m., a press conference was held regularly to update the public on the COVID situation.
我觉得这对民众来配合民心的安定的话，非常非常的重要啊！这是我们在 SARS 之后学习到的一个经验。
看大家的士气都很好，那也知道自己肩负的是一个很重要的国家的责任，就是我们要保护我们的人民。
SARS 之后我们对全世界流行的这种疫情，我们都很小心。 尤其是对于来自中国大陆的疫情的讯息，我们更加的谨慎。毕竟我们有几百万人在这之间这样子流通。
Taiwan was praised for its quick response when the virus first emerged. The nation of 23 million people had recorded close to zero local infections for months. But in May 2021, Taiwan was hit by its worst outbreak with daily numbers in the tens of thousands. Questions were being asked about why the population wasn't vaccinated despite having the benefit of the lead time.
刚开始我找这些疫苗厂谈的时候，他第一个讲说他不会卖给台湾，他更不想跟我谈。他说你就去找世界卫生组织。那我就跟他讲说，我们不是世界卫生组织的会员国啊。它当中的过程的里面有一些当然也遇到一些的波折跟艰辛，但是感谢了哈。 感谢同仁的努力，我们一关一关，即使不是很顺利的，我们一关一关的克服。
Despite facing huge public pressure, Taiwan's authorities remained resolute in their trust of the public health experts. They understood that updates and press conferences played a crucial role in maintaining open communication, a lesson learned the hard way 2 decades ago during the SARS crisis.
We found that Taiwan is inadequate to cope with any outbreak of emerging infectious diseases. So we have to improve the entire epidemic prevention system in Taiwan. So it took us 18 months to do all this kind of revision and all the upgrade of our Taiwan's epidemic prevention system.
遇到疫情的时候，我们的敌人 除了细菌病毒之外，还有错误的讯息跟谣言。
Starting from our SARS outbreak, we learned 17 years and prepared for 17 years. I always say that in Taiwan at that time we have 23 million unsung heroes because everybody follow the governmental guideline so well.
So, Dr. Lo, that was a look back at some of the issues faced and how they were overcome. Given that, do you feel like Taiwan's learned its lessons? And in that case, how are we doing with regard to the surveillance for this current outbreak?
So after each big outbreak or pandemic, we do learn new lessons. And I think for COVID, we learned the lesson that surveillance is not just information collected officially from official government channel, but social media or soft intelligence are all very important. Or sometimes rumors need to be investigated to see whether it's true or not. So I think for this current fifth wave of COVID, we are collecting information online and also from our healthcare partners to see whether the severity and also people's attitudes towards vaccination and the people's attitudes for healthcare visits are changing or not. At the moment, we don't see any big change. And also, I think important to establish a very sustained and reliable relationship with our healthcare community, and also to establish trust among the public are two crucial factors to win the public during the pandemic and also panic era of those diseases.
Right, Anirban, throwing it a little bit into the future, there's a lot of talk about DiseaseX, and as I mentioned, that is going to be a topic that the WHO will bring up during the World Economic Forum. What is DiseaseX and why are we talking about it?
So DiseaseX is any disease that represents an unexpected high-threat new disease. So COVID-19 was definitely the first disease X of the modern era. And it highlighted the sudden outbreak of pandemics globally. Before that, in the previous century, all the pandemics were influenza pandemics, and the preparation was for an influenza pandemic. It's actually quite surprising, but coronaviruses were considered low risk before SARS, but post-SARS in 2002 and then post-MERS in 2015, there became a recognition that coronaviruses could be a potential disease X. But there are 26 families of viruses that infect humans, roughly around 120 viruses that do infect humans that we know of. But there are many more viruses out there in the wild, in animal reservoirs, that could potentially infect humans. And I think with closer human-animal interactions and with climate change, we will see some more spillover of these viruses. And so, as you mentioned, the World Health Organization annually updates a list of high-priority pathogens to identify which ones could be disease X. Now, they don't include influenza in this list, but avian influenza is definitely another virus that could be that could cause a pandemic in the future. So in their list, they have Zika virus, they have the hemorrhagic fever-causing viruses like Nipah and Ebola, which are definitely very scary. But I think in the future, and I'm curious what Dr. Lo has to say as well, I think the greatest threat possibly comes from RNA viruses because they have the greatest chance for mutation. But spread also is most likely from respiratory viruses because they're much, much harder to check and they can be airborne. But I think that this is what the World Health Organization is looking into when they're talking about disease X.
And Dr. Lo, would you like to respond to that and tell us your thoughts on disease X and whether Taiwan is talking about it enough?
Yeah, Taiwan is not stranger of disease X. Actually, we are at like the hotspot, the Southeast Asia and also Asia Pacific area are usually among the prioritized area of that kind of newer emerging disease could emerge from this area. So in the previous decade, we have encountered several different kinds of avian influenza and also Ebola in Africa and the Zika virus circulation around the world and the most recent COVID-19. And also between COVID-19 and the Ebola, we also had the MERS outbreak in South Korea. So in the border and also in our laboratory, we are always very vigilant amongst monitoring new patterns of disease or newer agents. For example, last year in autumn, when we hear that there is a child pneumonia outbreak occurring in northern part of China, we immediately started to do enhance our laboratory monitoring at the airport among travelers coming from China, Hong Kong, and Macau. So far, we haven't detected any unusual pathogens, but we do have that kind of panel laboratory that can survey more than 20 different kinds of viruses and bacteria at the same time to enhance the speed and also the accuracy of detection among disease X category. And also the healthcare facility and the network are very aware of the possibility of having a newer pathogen. So it's always in our preparation, in our daily work.
You know, Anirban, Taiwan has the advantage of having a very sophisticated health system, and as Dr. Lo was mentioning, monitoring system also, and also the fact that they have a system to check what's coming in and out of our borders, but many other countries don't. So in that case, how concerned are you about this next outbreak that could once again become a worldwide issue?
So I think it's only a matter of time. We have to be concerned that because pandemics happen, they will continue to happen as population increases, as we encroach on areas where there are more animals, as climate change increases the range of many of these vector-borne diseases that are now occurring in parts of the world where they never happened before. As global travel increases, there's more mingling, there are greater events where people are mixing together, there's more opportunity for disease. And I also would like to say that it doesn't have to be, we've been talking mostly about viral diseases. It doesn't have to be viral diseases either. There could be new rise of bacterial diseases and even fungal diseases. But I think, as Dr. Lo mentioned, there are things that we should do in advance of the pandemic so that we don't wait until whatever pathogen comes has already infected a large number of people.
Dr. Lo, Anirban talks about viral and possible fungal diseases, but going back to what's also, I guess we spent a lot of time trying to find out about is COVID-19. Are we any closer to understanding the origins of COVID-19? And if not, how do we then prevent future diseases if we don't understand where they came from?
I think the true origin is still a lingering question, even after WHO's repeat investigation and the inquiry by the global partners. I think there's still no clear answer from China about the origin. But I think the consensus at the moment is it's very likely emerging from the animal-human interface. And I think that's also not unusual for a lot of those DiseaseX or unusual pathogens. So a very important thing is to be aware and to be vigilant about the possibility of a pathogen jumping from animals to human. So the keywords are here to keep monitoring, especially about the laboratory capacity, and also to be aware that the health sector and the agricultural sector need to work together. We have a concept called One Health. So anything that happens in the animal world can be immediately notified to the human health sector. So we are working together hand in hand to protect the world, not only for human, but also for other animal species as well.
And Dr. Lo, given that Anirban briefly mentioned the impact of climate change, can you explain why that is something we need to really take into account when you're looking at these future diseases?
I'll just say one example. For example, dengue is still considered an outbreak pathogen in southern part of Taiwan. But with the trend of global warming, we are seeing more and more likely for dengue to have a bigger outbreak and also a possibility to spread to other parts of Taiwan because of the changing habitats of the Aedes or the mosquitoes that cause dengue. So we are connected. It's a one world. So any temperature change of the seawater or the climate will lead to change of the ecology, and that could impact human health and animal health together.
Right. We're coming to the end of the show, but before we go, Anirban, you are set to release your second book, When Drugs Don't Work, The Hidden Pandemic That Could End Modern Medicine. That's ominous. Can you explain the premise?
Yes, absolutely. So we've been talking about single pathogens, but there is an undergoing hidden or silent pandemic right now, and that is of antimicrobial resistance. And people don't talk about it that much because it's not one organism or affecting one part of the body. But right now, we have bacteria or superbugs of strains of bacteria that are resistant to all known antibiotics. And in the past few years, we haven't actually had any new classes of antibiotics come up, any new major classes that have been released. So there are cases now coming in hospitals where doctors have to say to patients that we don't know how to treat you. And that's scary, but that's actually poised to rise more as more of these superbugs spread across the world. So without new antibiotics or without a pipeline of new antibiotics, we could be looking at a post-antibiotic future, which is just as scary as the pre-antibiotic one.
Right. And Dr. Lo, what are your thoughts on that?
Yes, I think antimicrobial resistance is emerging as a very severe issue in Taiwan because we are having an aging society with a lot of more weaker immunity people. And also the community-acquired antimicrobial resistant pathogens are also increasing. So to protect human health, it's also to a very crucial weapon. Antimicrobial agents or antibiotics need to be also protected. Otherwise, we'll have no weapon to target against the. So we are stepping up with a long-term project to enhance regulations among the antimicrobial use, not only in human sector, but also in animal and plant sectors. And also we work together with other partners to advocate for judicious use and the stewardship of those antibiotics, not only in the hospitals, but also in outpatient clinics. So the use and also supply can be ensured by these long-term projects.
You know, I like to end the show on a positive note, which has proven to be a little bit difficult given the tone and the subject we're dealing with. But Anirban, before we go, can you give us a reason to be positive about managing future health crises?
Absolutely. I think if we learned anything from the COVID-19 pandemic is that it is possible to find treatments and to develop vaccines. So I know we talked about DiseaseX and we talked about what the next pandemic might be, but the platforms that were created during that time, including the mRNA vaccine platform and other vaccine platforms, would be very, very useful in combating future pandemics. So I think that's definitely one approach. Then the other is finding pan-coronavirus vaccines. So not just for one coronavirus, but for multiple coronaviruses that could be created using similar platforms. So I'm very hopeful about that.
Thank you so much for being part of this very important conversation. I'm afraid we'll have to leave it there, but thank you, Dr. Philip Yi-chun Lo, Deputy Director General of the Taiwan Centers for Disease Control, for speaking to us from Taipei, and from Washington, D.C., Anirban Mahapatra, microbiologist and author of COVID-19, Separating Fact from Fiction. And for our viewers everywhere, it has been good to have your company. If you've enjoyed today's episode or have anything you'd like to add to the dialogue, do join the conversation on our social media. And remember, stay informed, stay engaged, and stay connected.